consciously translate visible energy into energy of pressure. Beauty only furnishes probabilities. We are really admiring the tactile quality which has been made visible. Impressions which express.
Hi, everyone. Thank you so much for joining us today. I realized we asked some of you to drop your names in the chat, but the chat is disabled, so sorry about that. We're still getting used to webinars 2 years into this. But thank you so much for being here. Sorry that there isn't a space for you all to introduce yourselves, but I see a few folks have shared who they are in the Q&A, so we really appreciate that. But we'll get started with the content for today's event. We just want to let you know that just before we dive in a little bit about our agenda, first, we'll talk a little bit about the work that falls under this program for vaccine confidence, which is a collaboration between IDEO.org and the National Resource Center for Refugees, Immigrants, and Migrants. And we'll keep this section short so we can focus on sharing the tools and resources that we have for today's work. And then we'll do the deep dive into the Healthy Spaces Toolkit, which is what you're all here for, what it is, who it's for, and most importantly, how you can use it. And our goal is really for you to leave this call knowing exactly where to find resources that can save you time and help you make your space more culturally affirming and welcoming to the refugee, immigrant, and migrant communities that you serve. And finally, we'll pass it over to our partner in developing all of this work, the Champaign-Urbana Public Health District, our colleague Whitney Greger, who will be sharing the perspective of actually implementing these recommendations. The CU PhD space transformation is still underway, and Whitney has unparalleled insight as to what's easy, what's hard, and in applying all of this work and these tools. And then finally, at the end, we'll have 15 minutes for Q&A, and I do believe that the Q&A function does work. So if you do have questions, drop them in there, and we will certainly be able to answer those. And we'll also be sharing links to all of these tools throughout the presentation in the chat function. But just so that you all know, we'll also be sharing the slides and all of the links that we drop in an email to all of the attendees after the webinar. So without further ado, the work that you'll see here today is hosted by the National Resource Center for Refugees, Immigrants, and Migrants, shortened to NRC-RIM. NRC-RIM is funded by the Centers for Disease Control and Prevention and housed at the University of Minnesota. They exist to support health departments and community organizations working with refugee, immigrant, and migrant communities that have been disproportionately affected by COVID-19. And they do this by strengthening partnerships between health departments and communities and supporting organizations that work with RIM communities. NRC-RIM supports organizations by collecting and disseminating best practices, health communications and health education, and by offering online training. They also provide technical assistance and a few other services. And we'll invite you to explore the wealth of resources available on NRC-RIM's website after this webinar. And I'll share briefly about IDEO.org and the Vaccine Confidence Program. At IDEO.org, we are a nonprofit design studio, and our mission is to work alongside communities to design towards a more just and inclusive world. We use an approach called human-centered design, which simply means that we center people who will benefit from and use the solutions as key decision makers and influencers. So community-driven work is likely something very familiar to many of you in this group. Human-centered and community-led design means that people who this work will impact have the power not just to input on the work, but ultimately are the drivers, influencers, and decision makers of what we're creating. So this means surfacing the challenges and needs that communities are facing, to co-creating along our design teams, to offering feedback or ideas, to even testing the concepts with their fellow community members, and finally co-creating strategies for rollout and implementation. And we really believe that when it comes to sharing information, who is sharing the message is just as critical as what the message is. So our work really seeks to engage leaders who have already built trust in the community to serve as messengers, which is why we've partnered with folks like Whitney and the Champaign-Urbana Public Health District, because they have really gained that community trust. And so our overall impact goal is to increase vaccine confidence and improve vaccine uptake in refugee, immigrant, migrant communities. And we do this by creating easily customizable and accessible toolkits, ranging from communications to increasing awareness, so that you can increase awareness and confidence in the vaccine, to services that you might actually use to get people vaccinated. So we have a couple of tools that you could try out based on the communities that you might be serving. If you're trying to increase vaccine uptake among mothers from refugee, immigrant, and migrant communities, you might use a toolkit we've called Mothers for Mothers. We also, if you're trying to build confidence in your community broadly, you might use Vaccination Is. And if you're trying to reach young people in your community, you might use a toolkit we're calling #NoJudgment. If you are returning to doing in-person events and want to make your space culturally inclusive, and what we'll hear about today, you'll use Healthy Spaces. And finally, if you want to develop materials that acknowledge doubt, highlight stories from within your community to encourage behavior change, you might use Honest Conversations. So Honest Conversations is not yet publicly available, but we are planning to host a webinar on November 15th to share that toolkit. So please mark your calendars, and we hope to see you then so we can share that tool more broadly as well. And with that, I'll pass it to Claudia to introduce Healthy Spaces.
Hi, everyone. My name is Claudia Sosalazo, and I am a program lead at IDEO.org. What that means is that alongside Riddhi, I help to support and oversee all of our projects that relate to vaccine confidence. I'm going to go ahead and share my screen so that I can introduce you to the Healthy Spaces toolkit and actually show you how the toolkit works, how to use it, and how to apply it. Beautiful. 1 second. Lovely. Great. So without further ado, Healthy Spaces is a toolkit that can help you rethink the way that your physical space is laid out. And one of the starting points for our discussion today is why space matters, right? And especially what is the link between vaccine confidence and space? Well, to begin with, I'll just point out that the pandemic has really been an opportunity for us has really highlighted the need for healthcare providers to rethink and strengthen trust with all communities, and refugee, immigrant, and migrant communities are no different, right? We really see this opportunity moving forward to shape public health efforts and to transform systems so that they can serve communities, especially historically marginalized ones, better. Additionally, one of the reasons why we felt it was important to focus on space is because in our world, in our country at the moment, there is an abundance of subtle signals that signal to individuals coming from refugee, immigrant, and migrant backgrounds that they may not be welcome or that they may not belong. And we wanted to flip that on its head to really ensure that a person who is seeking a service, who is seeking support when it comes to health, can, even before they walk into a building, feel really welcomed, invited, and celebrated. So that is a little bit of the impetus for this work. In addition to that, this work really started in the summer of this year when there was a return, or starting to see more of a return towards in-person spaces. And so we felt that there was an opportunity here to really take advantage of that return to more in-person gatherings to really rethink and create welcoming spaces. Now, how did this toolkit come about? It really came about through a partnership between IDEO.org and NRC RIM and the Champaign-Urbana Public Health District. We're so excited for you to hear from them really about their experience of applying the work. But essentially, we began a conversation to think collectively about how we could strengthen those ties between Champaign-Urbana Public Health District and the refugee, immigrant, and migrant communities in their area. And space came up as one of the main topics, specifically because CUPHD hosts this cooperative, already has this initiative called the Immigrant Cooperative. And essentially what the Immigrant Cooperative is a coalition of 6 organizations that provide an array of services to the community. They include a free health clinic, immigration and legal services, social support, and more. The organizations in this cooperative are all invested in improving health outcomes for immigrants and refugees they serve. And CUPHD has generally offered all of these organizations a subsidized space. So these organizations were already being hosted within the CUPHD building. And there were a couple of pain points that prevented the space from serving really as the community hub that was originally envisioned. The space is housed the overall space is housed in a basement, and a lot of the signage is in English. And so we found an opportunity to really partner to ease some of these pain points and to bring about a vision of turning this location into a community hub. In order to do that, we worked very closely with both staff and clients of the Immigrant Cooperative organizations. Here, I just want to, I won't read it out loud, but you can see the Immigrant Cooperative mission statement. And I just want to take a moment before we go into the actual tools to acknowledge really all of the contributions of everyone in the team who worked with us. A lot of times, or often really, the experts in how a space could be transformed, what a space needed in order to be more welcoming and inclusive. A lot of these solutions really came from the staff and the clients who use the space in a day-to-day basis. So just want to take a moment to really acknowledge their contributions before moving forward. In order to develop the toolkit, we really engaged in a number of collaborative and creative generative activities. Here you can see an image of an activity where our team is trying to identify, what goals really serve the space better, be it, creating spaces for privacy or creating moments for information. In addition to these kind of workshop moments, our team engaged in a number of different walkthroughs. We also collectively created and tried, putting different things up on the walls to see what would really resonate. And what you'll see today is really a result of what was most successful. Now, what can this toolkit help you do? The toolkit of healthy spaces is really oriented around 4 goals. First and foremost is building trust and comfort on arrival. That's, creating the sensation for an individual before they even walk into a space of really knowing that the space will be safe, that their presence there will be welcome and celebrated. Secondly is helping individuals navigate space confidently. And part of feeling really safe in a space is knowing with confidence where I can be, where I can sit, where I can go for help, where I can get a glass of water. And so we spent a lot of energy thinking about how to create inclusive signage for anybody who is coming in the space to be able to orient themselves. Third, the toolkit was really designed with versatility in mind. As I'm mentioning, the space that we were originally designing this for was a space that's shared by multiple organizations. So we wanted to create recommendations that could apply, whether the organizations are hosting a health fair or a vaccination clinic or an exercise class. And then lastly, the recommendations in the Healthy Space Toolkits are oriented towards creating and turning a space into a community hub. And this is really the vision of CUPHD that inspired all of this. So without further ado, let's actually go into the playbook, and I'll go ahead and take you through the website, take you through the tools that are there, and then pause at every section so that we can hear from Whitney about the application, about the experience of actually using the tools to improve a space. Now, before I share the website, just so that we can orient ourselves, the Healthy Spaces Toolkit has 3 key components that are all intended to achieve those 4 goals that I just went over. The first component is around creating a simple way for clients to navigate the space. The second one is recommendations to create a welcoming and culturally inclusive inclusive space. And then lastly, there are tools there for raising awareness. So without further ado, here is, and we'll drop the link in the chat. And again, you'll receive it in an email. I know that we've shared already lots of different information and links. Here is where all of the Healthy Spaces tools are housed. And this website is one page, so just one simple scroll, and it's organized across the 3 sections that I mentioned. The first one is around creating a simple way for clients to navigate the space. I'll go into the template shortly that you can use to create signs for your space and to create posters for your space. But first, I wanted to share some of the key research learnings that drove the design of the tools. So first and foremost, one of the key activities that our team did was to do space walkthroughs with clients. So we tested, kind of different visualizations, different types of posters, and we spent time observing individuals and having them just talk out loud about what they were seeing, what they were perceiving. One of the key things that emerged from that exercise is that people don't read big chunks of text, right? Not surprising, but especially if we're thinking about posters that might be created in multiple languages. It is not super helpful to include, say, the whole mission statement of an organization, even if it's translated in multiple languages. It just kind of generates a lot of blocky text that people don't pause and read. Instead, what we learned and what became really clear is that people look out for keywords, right? And so if they're looking for a clinic, they might look for the word health, and they might look for that in multiple languages. But even if someone isn't, say, super comfortable in English, these initial keywords are the first things that they start to look for. And they're also sometimes accompanied by younger children who might be more comfortable in English thanks to their school. And so centering and highlighting really those keywords can be really helpful in helping individuals navigate a space. So one of the things that we really recommend is in your own signage, really thinking about, is it the word legal? Is it the word health? What are the 2 or 3 keywords that really encapsulate what you're offering? And then secondly, when it comes to images, we tested a number of different ranges of icons, and again, it became quickly emerged that really photography, a really powerful image, say, if it's health of someone with a stethoscope, can really help to orient someone about what they're about to walk into or what the experience is going to be for. Lastly, one of the things that our team learned is that choosing colors consistently through a space can be really important. So at the Immigrant Cooperative, say, all of the health related services are always in purple. All of the legal services are in orange. And kind of using that throughout can be really helpful for individuals to kind of understand where to go. Now, what can you do with all of these recommendations? We've actually created a tool so that you can mock up your own signage and send it to print. And I'll walk you through it briefly. But if you click on the making signage, you'll see this document, and if you click on use template, you'll arrive right at this document, and this document kind of walks you step by step through the process of creating your own signs. And you can create your own signage, you can create your own posters, kind of highlighting the services that are on offer. So the first step that we kind of walk you through is identifying the keywords that I was just talking about, be it health, be it legal. Then we offer you a series of colors that you can select from, and then you can kind of start to mock up what these signs will look like. The third step is to identify the type of sign that you want to make, whether it be entrance signage, whether it be directional signage. These are signs that you can print really, really large size to say, like, put on a wall or put on a door. And then also we have templates here for service posters. I'll mention that with the directional signage, we will eventually need to use Adobe just because of the large size that we'll be printing at. But what you can do here with this Google Slides template is that you can start to just kind of all of this is editable. So you can go in and type in the words and the names of your organization. So you can use this information to make a mock-up of what it will look like, which will save you time, say when you're working with a graphic designer or your local print shop. You can show them a mock-up of what you want the sign to look at, and then that local print shop can use the template that we've created in Adobe to kind of bring your vision to life. With the posters, however, you don't need to use a graphic designer at all. You can very simply, here we've included a set of stock images. All of these images are open sourced. So we've taken care of ensuring that the licensing is appropriate for you to use. And we've also selected a number of images that also kind of showcase and celebrate diversity. So you can kind of very easily select the image that you like and simply copy and paste it into the poster of your choice. So once you then select the kind of poster layout that you like, you can again go ahead, edit these keywords as you wish. You can add the logo of your organization, you can add the name of your organization, and then whenever your poster is ready, you can simply click download into a JPEG and just send it to print. So those are some of the tools that are there for you on the website. And since I've spoken a lot, I'll pause now and pause it and pass the mic to Whitney, who will share a little bit about how these tools have been used within the Champaign-Urbana Public Health District.
Hi, everybody. I don't have a screen to share, so you just have to listen to me talk. My name is Whitney Greger. I'm the Director of Wellness and Health Promotion here at the Champaign-Urbana Public Health District, and I had the pleasure of working with the IDEO team to kind of transform our immigrant cooperative space. And I will say that the signage was like the single most important part of our revamp of our area, just because it is such a large kind of open space. And when you enter the space initially, it is sort of like, you know, or you get taken aback from how big it is, and it's hard to find your way around. So really the color coding and the keywords and also pictures, simple pictures can go a long way to tie in with the keywords and the color coding to help people that might have low literacy levels or don't speak English or don't speak any of the translations on the print materials. That really helped probably the most with wayfinding. And also with our signage and wayfinding, we decided to completely move the main entrance of the Immigrant Cooperative to another side of our building. The original entrance is kind of nestled in a group of like 4 entrances for 4 different organizations. So we moved the main entrance to an entrance that's by itself. It's close to the parking lot. It has a sidewalk path up to it. And we're going to put a mural and signage on that particular wall entrance to kind of signal it as the entrance to the Immigrant Cooperative. And that, along with the signage that we've been talking about, really, really helps or will really help people kind of navigate the space a lot easier. And like Claudia had mentioned, you know, as soon as they enter the parking lot, they'll see that mural, they'll feel welcome, and they'll know that when they enter the physical space that it'll be the same sort of experience. Definitely the signage was the most important. And I will say the toolkit is very helpful when you're communicating with the people at the print shop, at least for me, because I don't speak print shop language. I don't know what they're talking about. So it's very easy for me to literally just like hand over the tools that I had. And I said, I need this many of this poster in this size. And it was sort of easier to communicate in that way. And there wasn't a lot of like complicated conversation around what we needed. It was all sort of done for us, which was immensely helpful. And definitely just with all the organizations that we have in our Immigrant Cooperative, the color coding and the directional signage, there's a directional sign that points you to the door of our health clinic, and the whole door is purple. And it has a picture of like a health related picture. So it's much easier for people to kind of navigate and find what they're looking for.
Thank you very much, Whitney. I'll also go into the next section of the toolkit. And I see that there were some questions in the chat. Aya, to your question around how the toolkit works versus Google Slides and Adobe, just very quickly, the way that the toolkit works is that we've designed this document so that you can make a mock-up of what you want the signage to look. Unfortunately, printing, especially like if you're printing for a door-sized sign, so for these signs, if you're printing for a door-sized sign from Google Slides, it'll be a little bit pixelated. But what we've done is that we've included an Adobe toolkit here. So if you're not a graphic designer, what we recommend is using this to make a mock-up of what you want it to look like. And then when you're working, say, with a graphic designer, either at a print shop or someone from Fiverr, they have already the template in Adobe and they have your mock-up of what you want it to look like. So it can help make that process a lot faster. With the posters, however, there's no need to like transfer from here to Adobe. You can just go ahead directly, make what you want into the poster, and then download the JPEG and print it. And all of this is simply you can click and edit the text so that, you know, if you want it in a different language, if you want it in a different color, you can go ahead and make those changes. We have added a number of colors that we recommend at the top, just in case that's helpful. But if you want to match your own organizational colors, that's totally possible. I see a lot more questions. For now, I'll go ahead into the next section of the toolkit, but we will have a moment of Q&A towards the end. So do keep typing those questions. Rivi, Whitney, and I will address the ones we can in text. We'll also have a little bit of dedicated Q&A time towards the end. Now, the second part of the toolkit that I wanted to highlight for you all is guidelines around creating a culturally and welcoming space. And some of the recommendations here, this section does not have a toolkit, is a set of recommendations, but as Whitney was saying already, she can talk about how they've been applied at CUPHD. Some of the ones that I'll highlight instead of going through each of these one by one is really ensuring that the entrance to a building can really be culturally and visually affirming. And then another thing that we really heard from clients of the Immigrant Cooperative, clients who go to these spaces when we were asking them, you know, what would make you feel welcomed, is really one of the things that came up is seeing photographs from home, seeing landscapes from their home, seeing places and seeing culture really celebrated. To that end, we have compiled, if you click on these links, they'll pull up a Google Drive and you'll see just a section of images. Again, all of these are open source, so you can just go ahead and select and print them that we have pre-selected for you. So that is one very simple thing that you can do if you that you can do after today is go through images that we've pre-selected, print a selection, and of course add to the selection to ensure that the different communities that you're serving see themselves represented and celebrated in the space. The second thing I'll highlight from here, there's a couple of more options for you to read on your own time, but we also were exploring and noticing that a number of clients for the Immigrant Cooperative go to the space with their children. The Immigrant Cooperative space already had a kids play area. We have some recommendations here about how to strengthen that play area, but one thing that emerged and was really important is that even if there's also sensitive conversations that need to happen in a privacy booth, it's very important to have and to make sure that the kids area can be within view. So if you are exploring any sort of privacy booth spaces, making sure that parents can still keep an eye on their children is really essential. And from here, I'll pass it again to Whitney to share a little bit about how CUPHD is applying this work, and also maybe perhaps to talk. I have an image of the mural if you want me to show it, Whitney.
Sure, that sounds fine. I think the biggest thing that we're doing here at the health department is that change of the entrance, which this is going to be the main entrance. It's this is a picture of it. That's the door on the right there. This is a mock-up of the mural that we're working with a local artist. And this is his mock-up of it. And we've sent it around for kind of an initial review of opinions, and we've gotten some really good feedback, and there's some changes to this that will happen, and then the final one will go up hopefully before it gets chilly here in Illinois. So this is probably the biggest one, and it's really a signal to people even before they enter the building that this is a safe, welcoming, affirming place. Just in our location, we're located on a fairly busy street, and so, you know, people that aren't coming here can see that as well. And we are pretty close to a pretty major interstate, so it's getting a lot of eyeballs on it, which is great. We're really excited for that. So that's probably the biggest thing we're doing. I will say that the children's play area, like Claudia had mentioned, we did have one existing, but we sort of moved it and made it a little bit more kind of accessible from all angles, because it is a sort of a big, large open space. So we put it in the middle so that, you know, parents could see their kiddos at any area wherever they were in the space, so they could still have an eye on their kids even if they were kind of tucked away doing a private conversation. And then adding in like privacy dividers and booths so that if there was a conversation, a lot of the services offered here are legal services, so having a private area that people can kind of talk more intimately was important. And so adding those spaces was a big thing that we did. I will say just like the general vibe of the area as well improved a lot. Before IDEO came, there was just sort of it was just sort of chaotically put together, I would say, like not a lot of matching furniture, just kind of random signs all over the walls. And so we did create a space. There's a dedicated space on one wall near the entrance that is for like all flyers, event information, brochures, things like that. And so it's not as like willy-nilly all over the walls. And there's one central place that people can kind of go to see what's going on in the community. And then the final piece that I think is really interesting is there was conversations about a staff area that staff could go and have some privacy, have time to relax, have time to sort of decompress from the work they do. And I think that's really important just to note, because a lot of the work that is being done in the Immigrant Cooperative can be very emotionally taxing. And I think it's important that we create spaces for staff to be able to go relax, you know, do whatever they need to do to take care of themselves, because this is the nature of this work, is that we're putting our, you know, blood, sweat, tears, heart, and soul into it. And so it's important that they have an opportunity to decompress. So that space has been added, and that's really exciting for us and for staff to have that opportunity to have a more private space.
Thank you very much, Whitney. We'll go briefly over the final part of this toolkit, and then we'll really open it up for your questions. So lastly, this last section of the toolkit, I will say it was created from feedback from other organizations, in addition to CUPHD, who kind of saw this toolkit in evolution. And other organizations were asking also for tools around raising awareness of a space, right? So here you can find some tips around just how to share news of a space. And most importantly, we've created some tools and templates that you can just go ahead and directly use. And our goal is that these will help you save time when promoting your space. So first and foremost, you'll find here some text that you can quickly edit, copy, and paste into any messaging app of your choice, be it WhatsApp or Messenger or Viber, to help invite individuals to an event in the space. So that's all here and ready to go. But then most importantly, we've created a template. So we know that a lot of times creating invitations and making them beautiful can take an inordinate amount of time and an unnecessary amount of time. So our hope is that we can help you save time by using the template. And just so the way that this works, again, you'll click the button, it'll take you to a Google Doc. Again, the Google Doc we've selected because it's open and free software that you can use as long as you have a Wi-Fi connection. Once you click use template, you'll be taken to this document. And again, this document is fully editable by you. So once you've opened it, a template, it is yours to do with it as you wish, to take it, to edit it, to to make it your own. And so what we'll notice here is that we've included some guidelines in the margins. So the margins kind of instruct you how to change the invitation to really make it appropriate for your event or organization. So all of this again is just kind of fill in the blank. You can go in ahead and type my event name here. You can add your logo, you can edit, of course, the location and the time. And then we've already gone ahead, and if you scroll down, you'll see that the template has been edited to include a number of different languages already. Of course, if there's a language that you want to create an invitation for that isn't represented here, all you have to do is go ahead and type. We've selected fonts that specifically lend themselves to kind of looking well visually with a number of different scripts. And then right at the very bottom, there's a number of different images. Say if you wanted to edit the overall image, you can just go ahead, copy and paste people into this space so that it looks just the way you want it. And again, whenever you're ready to go ahead and share this, be it on social media, be it on WhatsApp, or be it by printing, all you have to do is go ahead, download the image there. So we hope that this is helpful. I know, Whitney, that this is not something that was primarily created for CU PhD. Is there anything you'd like to add about this, or should we go ahead and transition into Q&A?
I think Q&A would be great.
Awesome. Before we transition into Q&A, one final thing from us, which is that we have pilot grants available. So we understand that a lot of this work that we're sharing takes time, energy, and resources. We have a limited number of pilot grants available if you would like to test out these tools. So specifically maybe to like cover, say, the printing costs of printing signage. And if you're interested in participating in a pilot grant and receiving a pilot grant, send me an email. My email is there on the screen. We'll also include information about this in the follow-up email that you will receive with all of the links to all of the tools we've shared today.
Awesome. Thanks so much, everyone. I'll start us off with the Q&A and just want to reiterate some of the answers that we've gotten to some great questions in the chat before we ask some questions to Whitney more specifically. You can absolutely change any of the colors in the templates. We have some guidance around what colors, seem to work well in, in the groups, but feel free to change any of those colors to match your organization's branding or to colors that you think would be more appropriate for the communities that you're serving. We will absolutely be sharing all of the links and resources that we've shared here today through email after the webinar, as well as the slides. You should be able to type, as Claudia was just mentioning, you should be able to type in any language script using the templates. The font selection that we've chosen is slightly wider, so that it's a little bit easier to be able to type in different language scripts. We've also considered, right to left and left to right language scripts so that it should be able to work for most language scripts. And then again, there was this great question around, there are some templates that are in Adobe files, and there are some templates that are in Google Slides. For the templates that are for Adobe, those are slightly larger, like physically larger posters, which would get, slightly pixelated if they were designed in Google Slides. So you can click the link to download the Adobe file, so you can send that directly to the printer, who will know what to do with that Adobe file. And then for anything that's in the Google Slides templates, you can directly download and print those. So I'm going to move then to the questions that we still have. There was a question around interested to know some of the word phrases that we have. Just want to know if we choose a certain language that, some of those phrases might change, and wondering if anyone has any thoughts about maybe what's the best word to choose, knowing that, it might change for different languages.
Maybe I can start to weigh in a little bit on that. again, what we heard through a lot of the research and through a lot of the conversations that informed this was that when it came to language for signage and for posters, having language that was brief, like, really focusing on those keywords that, instead of saying, resettlement agency, what does that mean? Saying things like food assistance, job assistance, legal, health was a lot more tangible and immediately could be grasped a lot more easily by folks as to like what actually was on offer. And then when it comes to just kind of general language, having humility and a spirit of really wanting to be welcoming and culturally affirming is what informed some of our language choices. But obviously we realize that, when it comes to translation, and there's both a rigorous process that goes into the translations that we make available, but additionally, we recognize that there's so many nuances and connotations that we really encourage, and we make the tools editable so that individuals who are taking these tools can select and adapt for really what most resonates within their communities, given their expertise.
Awesome. Thanks so much, Claudia. And I'll just quickly answer the other question around fonts. We have selected specific font types for all of the templates that we have, and recommend that you continue to stay with those same fonts just because it offers, some balance of the composition of the posters. I'm not personally a visual designer, and so I can't speak to why the fonts are chosen exactly the way they are, other than, you're able to translate to different language scripts, but I trust our visual designers' choices in the language or in the font choices. But, these are your templates. So if you want to change the fonts, you should do that. I'm going to move us to a question specifically for Whitney. Whitney, curious, in implementing all of these changes, what has taken you by surprise, and what would you suggest to other organizations who are really trying to improve their space?
That's a good question. I would say the one thing that kind of took me by surprise was just the sheer woman power it takes to like implement all of these changes. I don't know what I was expecting, but I find myself spending a lot more time on implementing the changes than I thought I would have. And that's why I sort of like took it on by myself, because I was like, yeah, we're going to hang up some posters. We're going to move some furniture. It's going to be great. No, that's not what we're doing. It's a little more intense than that. It's a little bit more complicated than that. It's a lot more, we did co-create all of these design suggestions with organizations in the Immigrant Cooperative, as well as clients from the Immigrant Cooperative agencies. But there's still a lot of communication that is necessary to know, you can't just like move in a table in the middle of a workday, right? You have to like coordinate that and make sure that everyone's aware that that's going to be happening, so they can give clients a heads up, things like that. You can't just rip off door panels and put a door wrap on in the middle of the day. That takes coordination, all of that, putting together the mural list. We're in Illinois, so winter is coming here in Illinois, so the muralist, setting him up, making sure he can get all of that done on the wall before it starts snowing on him. But there was a lot more involved than I thought. And so if I could do it over again, I would definitely have like a small team of people, like one person you're in charge of furniture, one person you're in charge of artwork, one person you're in charge of, poster signage, whatever. I definitely do not suggest taking it on by yourself. So have a little team, 2 or 3, that would be great. And I would say, it took me by surprise. The one thing I always think about was how simple this was. Like really the simplest change was color coding and adding signage, right? Like those are very, very simple things that make a huge difference, especially for us when the physical space has multiple organizations or multiple programs that people are trying to get to. So color coding, signage, simple wording, it really is that simple. There's not any like PhD requirement to be able to do this work. It is that simple.
Yeah, that's so helpful to hear, Whitney. Also, I know you and Julie are a scrappy team. And so I'm sure that that's true for many others who are listening into this webinar. So it's really helpful to hear, just your like real guidance on what is needed to do this work. I guess I think you've already kind of mentioned this, but like, for orgs with limited time and resources, and, if you just like had to pick one thing to do, what's the most impactful thing that you would suggest?
Definitely. The best thing we did, I think, is switching the entrance to make it more, it's easier to find, it's easier to identify, it's welcoming right off the bat. You don't even have to get out of your car before you feel that sense of community. That was number one, and definitely the signage and the color coding of just like, if you're looking for X, follow the purple path, that kind of thing. It really is that simple. And then after that, I would say the images of like cultural stuff from home, things like that, and making it more like welcoming in that way, that can happen sort of over time. And if you're looking to implement something pretty quickly, I think the signage and like the immediate welcoming on the outside of the building is really important. And then you can work over time to make, the waiting room cozier, or the kids area cozier, or things like that.
Yeah, really, really helpful advice. What are you seeing as the anticipated impacts of this work? Like, why, I guess, to put it another way, why do you think that this project was worth the time and energy that it required of you and the team?
Yeah, that's a really good question. I definitely think, so we started the Immigrant Cooperative back in 2019. And so that partnership and those relationships are super important for us as the health department during COVID. We were able to push out messaging for isolation, quarantine, and then when vaccines rolled out, we were able to push messaging about that, because as the health department, we are technically a government organization. And so a lot of these communities might not be getting their information from our website or from our Facebook page or anything like that. So we were able to push messaging through trusted messengers in our immigrant cooperative organizations. And that was really important for us during COVID. And as COVID sort of changed, I guess, I won't say ended, but changed, this opportunity was a really good one to bring the team back together for our like original sense of camaraderie, and something around like, I don't want to say non-COVID because this is COVID focused, but another chance for us to come together to like keep momentum going. Right. So we were able to come together on this project, revamp the immigrant cooperative space to improve services for clients. And in turn, we have more people coming to our location. So the health department is, co-located with the immigrant cooperative services. So as people come to the immigrant cooperative for legal services, for housing, for food, for whatever, they might hop on over to the health department and get WIC, or have their kiddo in our dental program, or get STD testing, or blah, 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 whatever. So it's really a good like one-stop shop, no wrong door model is what we call it. And really having like a one space where families can come and have a lot of to-do checked off their to-do list, which is great. So we all love that.
Yeah, I think that's probably maybe unique about like the relationship that CU PhD and the Immigrant Cooperative have in being co-located. I think you're sort of pointing to this, like the value of having the organizations co-located, but like maybe more specifically around like health confidence and vaccine confidence, if you could share a little bit about what's been helpful in being co-located.
Absolutely. I think, especially with the vaccine confidence, like people don't want to just be like lectured about, the importance of it. You really have to have buy-in. You really have to have, not only facts, but like actual people's experience. These are legitimate concerns that people have, especially people from refugee, immigrant, migrant communities. It's not just your Uncle Bill that has anti-vax views, whatever. It's these people have legitimate concerns about vaccines and, long-term effects. Was it created too fast? I thought it was a 2-shot series. Now I have to get a booster. Now I have to get another booster. How does it interact with my other vaccines? Things like that. And so really meeting people where they are and having a safe space and, staff around them, like they could be talking about legal services and then go into a conversation about vaccines. And having vaccines available at like these health related outreach events that we throw, I think it's important to not completely center the event around like, oh, come here and get vaccinated. But the vaccine's available if you want it. So maybe the second, third event that they're going to, they're finally ready to get it. They've heard about it enough. They know enough people that have gotten it, and they're going to head right over to do it. Just making it an easy option for people, making their built environments. This is like public health 101, making their built environment like the default choice is the healthy choice.
That's awesome, Whitney. Thank you so much.
Yeah, no
I feel
problem.
like that's like a soundbite right there.
Perfect.
Like the point of all of this work.
Yeah.
Yeah, thank you so much, Whitney, for first of all, just all of your thought partnership, Julie and Whitney, the thought partnership in this project work so far, and for being so generous with your time today and sharing all of your expertise. We have a few more minutes. If there's any other questions, please do drop them in the Q&A. Unfortunately, the chat is disabled. That's my bad. But if you do have questions or even comments, please do drop them in the Q&A. And if there are no more questions, I'll wait just a little bit. I might just share my screen again to flash the pilot grants that we have available. Just give me 1 second to figure out my Zoom. We do have pilot grants available for anyone that's interested in piloting these toolkits. Please do email Claudia. Her email here is claudia@ido.org. And we'll also be sending you all an email after this, which also includes what this pilot grant is all about and what is available to you all. But it's essentially a stipend of money for people to be able to try out the Healthy Spaces toolkit, make some of these changes in your space, give us some feedback about what worked well, what didn't work so well with this toolkit. As an organization, we are very much open to feedback and constantly trying to ensure that our tools are really working for people. So, while your feedback may not necessarily change exactly this toolkit, it will certainly inform future toolkits that we develop. And maybe this is a question for Whitney, actually, from Aya. You may have already mentioned, but are there interpreters available on site?
Yes. And so in our particular area, we have a lot of Spanish speaking, we have a lot of Kwanhabal speaking community members, French, Lingala, and we do have a fairly large Afghan population. So Pashto is another language that we have. And so I know the Refugee Center, which is probably the organization in our Immigrant Cooperative that gets the most foot traffic. They have interpreters for all of those on site. And then I believe Avicenna is our community health center, free community health center. And they have a lot of volunteers. Where we're located in Illinois is also home to the University of Illinois at Urbana-Champaign. So we do have a lot of student volunteers and a lot of professors. So we do have fairly easy access to a lot of different language resources, which we're very, very grateful for.
Whitney, I think this is another question for you.
Fantastic.
If you have plans for still seeing people in case we have another lockdown, potentially a virtual space.
Oh, yikes. I hope that doesn't happen. But during COVID, a lot of these organizations in the Immigrant Cooperative, especially the Refugee Center and ISCU, the Immigrant Services of Champaign-Urbana and Immigration Project, they were able to see people virtually, but sometimes with this population, they don't have access to, Wi-Fi computers, that sort of thing. So having a space for like site visits, the safest way to do kind of site visits, fully masked, 6 feet apart, that sort of thing. They had to get creative with that. So I definitely think if this were to happen again, we would have virtual space options, but just keeping in mind that not everyone has access to that. So there would have to be some way to do, if not face-to-face, on a phone call or something like that, just to be sure that people aren't getting, slipping through the cracks.
Thank you so much, Whitney.
Yeah.
More questions. This is great. Okay, maybe this is one of the last few questions. Whitney, thank you so much for sharing your org's experience. Is there a toolkit sharing how other local health departments may be able to learn from your model of forming the Immigrant Cooperative?
Oh, an excellent question, and also very timely. Julie, I don't know if you have access to a microphone, but if you want to hop in here, feel free. But we actually, the Champaign-Urbana Public Health District is currently funded by the Illinois Department of Public Health to do sort of what you're asking here. We're working with 5 other local health departments to strengthen their relationships with refugee, immigrant, and migrant populations, and also service providers. So we're sort of, you know, replicating our model of the Immigrant Cooperative in other health departments in Illinois.
Yeah, the main thing, we started this after the election in, we started thinking about this after the election in 2016, when the immigrant, the RIM communities were being threatened, targeted, and feeling unsafe. We noticed an immediate dip in our WIC caseload, and we attributed it to that because we're a government organization. So what we wanted to do, because we are a anchor institution, we've been around since 1937, we plan to be here a long time afterwards. We wanted to get them in our building, get a clinic in there, and ICE, for example, cannot be coming in here because we're a medical facility. And so we put all of the groups in here together so that they could collaborate, cooperate, and people would feel more comfortable coming over and working with us. And it really did help. And we were just very fortunate to have started that prior to COVID, because that's why we didn't see some of the problems that we saw in other parts of the country, I believe.
Incredible. Julie, Whitney, thank you so much again for joining us today. Your insights have been tremendously valuable. Everyone, please do, reach out if you're interested in piloting these toolkits. We'll be in touch over email with all of the links and resources. Thank you so much, everyone. Take care.
Thank you.
Thank you.